Hey everyone, I'm your host, Renee Lizette Neethling, and welcome to my very first podcast of Succession, where we talk about everything from humans, animals, and everything that links us. Today we're talking to Lizette Neethling about animal assisted therapy. Now, thank you for being here. Thank you for taking the time and being
Thank
my
you.
very first interviewee.
Thank you.
So, Lizette retired in end of May 2024 as a military registered nurse, working as a practitioner for over 40 years. She first started at one mall and went over to clinical nurse in the community, working with cancer patients, maternal patients, and the elderly. Then she became a nurse in primary health. She raised her two kids as a single parent, which was challenging to her as she was brought up in a home where mom and dad was present. She had help from the community, from her church and her small groups. Lizette's children both went through university and have their own growing families now. I asked her how and when she decided that she would want to specialize in animal assisted therapy. Now, she told me that she has two dogs, as well as the corgi and Daisy the schnauzer, that she has been taking to daycare.
I actually registered Daisy for a socialization classes with. She's also a behaviorist, but also a nutritionist and animal physiotherapist. And the day of graduation, this first physiotherapist told us about the animal therapy that we can use our dog for, which is very well um, is a well rewarding activity, and we have to think of that as there's a shortage of these dogs to do the work.
Yeah, and then you decided to use Daisy, to focus on Daisy
Yeah,
first, because she's the social butterfly. She's the one that usually is more comfortable
yeah. Well,
with.
she has a very easy personality, and that time I was still working as full career, so it was all that's where my dream started. That I wanted to get involved into animal therapy and to use my dog for. So when I retired, I found out and I got all the information. I did my it's a reskilling course in animal behavior correspondence, and from there I made contact with Top Dogs, which is very much involved into this kind of activities. Yeah,
Okay.
yeah.
And what are you working towards?
It's basically voluntary. So I don't plan to start a second career at this stage. So it's pure voluntary to use Daisy as a therapy dog, as she's a working dog. So it's also rewarding for her, as well as I'm comfortable with the hospital or old age home or school environment due to my previous career. I just thought get involved and it's also rewarding for me as well as the patient. So just to be an instrument to assist with helping out where it's needed.
Yes, yes.
Yeah,
And like we previously also talked about serving others and being there, you have this great calling now where you decided, okay, I'm going to sit around while I'm
yeah,
retired, but rather use that time to serve others. And I think that's
absolutely.
great.
Yeah.
Usually, when we talk about animal assisted therapy, people don't necessarily know what it is.
Mm,
It is commonly known as physical therapy, but it's also for mental therapy, and it's
mm,
used for a couple of reasons. For
mm,
instance, when it comes to kids with autism, kids have difficulty with communication, and yes, that is where the autism spectrum comes down to. But
mm,
working with kids, with elderly, with all those people struggling mentally, and not just people with mental disorders or diseases, but also people that struggle with depression. And yes, that is still a mental illness, but working with people that has come from difficult backgrounds to people doesn't necessarily even have animals, and then these therapists are usually the ones that recommend animal assisted therapy. And with that being said, when it comes to treating a patient that we know, okay, let's say, for instance, a kid with autism, horses are very much used, but overall, it can literally be any animal that's being used. And the definition usually comes down to a therapeutic intervention that incorporates animals into a treatment plan, where sometimes with intervention, it's not necessarily always to do with a treatment plan, and the patients interact with the animals. And usually, other dogs are used with the cats can also be used, and we spoke about that also before.
Yeah.
Horses can be used, birds, but those are only the most common animals being used, where you can literally think of any animal and they could be used. The thing is just with that is that there comes a point where you have to decide, okay, what's going to be best. You know, if I'm a mother and I have a child with a physical disability that then needs therapy with a dog, so assisted therapy. What dog will I choose? You know, there's so many things to take in consideration, and also if I have the capacity to use another animal like a horse, which I've seen before, where kids with autism actually use horses
Yeah.
as therapy animals. You know, there's such a there's a big field, and there's so much to actually take in consideration when you decide what animal to use. And when it came to you, it was a bit more obvious that you will use either Daisy or Wallace. But there are people that need to decide, okay, what will be best for my grandfather, or what will be best for my child to actually continue with this therapy treatment, or this plan that we've discussed with the doctor or the therapist.
Yeah, and the other thing is, it became quite a problem, especially when somebody get at some age that he can't take care of himself, that they have to go to facilities where these facilities don't accommodate animals.
Yes.
So then most of these older people have to get rid of the animals, which is
Yes.
quite sad.
Yeah.
And it where the therapy dog, where when they have to uh, can go to visit these people at the homes, it means a lot to them,
Yes, of course.
um, because they're still grieving with the loss of their uh, children, and it it also makes a difference. It gives them a break in their day,
Mm.
uh, where there's boredom, where there's loneliness.
Yeah.
It's a bit of a socializing for these people, and yeah. Also, we also find that children with learning disabilities or did up a lot of trauma at homes where they don't perform at schools.
Mm-hmm.
Then these dogs can make a big difference,
Yes.
where they can uh, read stories to the dogs, and so perform better in school.
Yes, of
Yeah,
course.
yeah.
So when you talk about children and mainly dogs here, um, have you seen a bigger or a better outcome with dogs, or have you just been more exposed to dogs being used in therapy?
In therapy, I can't say really. It's I only started now,
Yeah.
so we're going for our evaluation now soon. So I can't really talk of experience,
Yeah.
but what I've known is, yeah, in a like in Top Dog as a more formal type of organization, and they do this from the 80s already.
Mm-hmm.
So sorry, from 2008. Um, that's what I know is that there's actually a waiting list of there's not enough institutions,
Oh
not
wow.
enough dogs
Dogs.
to
Yeah.
reach these institutions.
Yes.
Um, so it's actually for me it's in the beginning phase.
Okay.
Yeah,
Okay.
yeah.
Okay. I've seen a mix of how can I say a mix of um, animals being used. I've seen horses being used.
Mm-hmm.
I've seen I haven't seen this in person, but I have seen goats being used. You know,
Okay,
yes.
okay.
And of course, dogs I've been a bit more exposed to now.
Mm,
But so that's why I'm asking because the thing is with us in South Africa, and we've also talked about this previously, but there's
yeah,
not enough exposure of this, and
no.
not enough people know that horses are a bit more common, and then dogs are common.
Mm,
But where we actually are only starting to learn now that birds have been used for animal
mm,
assisted therapy, and it's not necessarily on a plan or
mm,
on a treatment
mm.
plan. It's more of having a pet as a elderly have a pet,
Ah,
someone to talk to, someone to care for, and that's the thing.
ah,
Um, we'll speak about that a bit later, but something to actually wake up in the morning for the
mm,
reason. Sometimes we lose our why, and
mm,
having animals to actually wake up to feed someone that wakes you
mm,
up and enjoy,
mm,
that's
mm,
always you know it brings so much joy into your life. And
mm,
for someone, if I can just imagine someone as an elderly that has lost maybe the love of their life, and they're alone in an old age home, they
mm.
do have friends, but they still mourn for that space that has been
The
left
lost
open.
emptiness.
Yes, yes.
Yeah.
So something like a bird or pet as a cat or a dog that fills that. So therapy is
Mm.
not always just a treatment plan. Sometimes it's, a void they fill. These
Yeah.
animals fill, yeah.
Yeah, I think like a helping aid
Mm.
to make a difference in that
Yes.
person's gap
Yes.
actually that they experience. It can even be pain, uplift the pain threshold.
Mm.
People being diagnosed with cancer or
Yeah. Physical
some
pain.
physical
Mm.
pain. Yeah,
Yes. Yeah.
yeah,
No, that is 100% true. And
yeah.
that's the question we come down to. Why do we use animal assisted therapy?
Mm,
And we can now, I can now speak about this and say that anyone can benefit from this. It won't just be someone in pain, but yes,
yeah,
this is more
absolutely.
commonly used. But
Yeah.
at the end of the day, we want people to have enriched
Mm,
lives with creating a space for another to also have an enriched life. If we look at what we spoke about previously, where we said about rescue dogs that
mm,
have been taken in and actually
mm,
been given a better life, and
mm.
also they enrich your life, but you also give them a better life.
Yeah, yeah.
So, but apart from that, there is mental and physical health conditions that we talked about
Mm,
that um, these treatment plans help with, and
mm,
sometimes it's prescribed.
mm,
It's a medical treatment plan prescribed by a doctor or by a therapist, and depending on the function of the therapy,
mm, mm,
people might either use an animal, like we previously said, they will have to choose what animal
mm.
to use. Some people are fortunate that they have the space for horses, and then that is the treatment or the animal they choose for their treatment plan.
Yeah,
Um,
yeah.
and then as it should enhance, people think about therapy, and then they have to choose which way to go. You know, if you think about the elderly that we've seen before, they have their physical therapy that they go for, you know, physical enhancement, and then also their mental therapy, you know, their psychology that they or psychologists that they see.
Yeah.
So
Yeah.
this is animal assisted therapy is not to replace other treatments, but it's rather to enhance it. I don't know if you could agree with that.
Yeah.
Looking at what we've seen, you know, and we, both you and I, haven't really had that much of experience in the industry, but I mean, we can see that it's not something that's there to replace treatment, but it's there to enhance the treatment that's already existing.
Yeah, I think it can assist as an aid, it's not
Yes.
really as a standard treatment, and it can also be prescribed by psychologists. Um, and not only to the individual, it can also help in a family aspect,
Yes.
you know?
Yes, and like we said before, it helps with pain management, with anxiety, with stress. So anyone in a family can experience that. And sometimes it's very unspoken of, you know,
Yeah.
sometimes we don't necessarily realize that a 15-year-old has been going through depression. And then after a while, it only gets discovered, but, or revealed, let's rather just say revealed. But when it comes to a point where, you know, if you have a very animal involved home, things like that aren't really known of. Things like depression, like anxiety, it's not really known of, depending on the, you know, the lifestyles of those people. But what I want to mention here is, according to the medical news today, that's then a platform that they they give medical news on. So the bond itself helps, like we said before now, the bond itself help a person, but in different ways. You know, something that we haven't mentioned now is reducing boredom. We don't think
Absolutely.
about that, but
Yeah.
actually
Yeah.
reducing boredom brings us to a point where we don't experience depression, we don't experience loneliness, you know. I mean, if we think about what we've talked about, where um, I have a Scottish Terrier, and well, it's my mom's, but I take care of her physically. So we go on daily walks, and that's been keeping me accountable to move daily and to be more active. Because if we don't go for walks like her, not just her action shows, but she like gets very depressed. She's like, nee, maar ons moet gaan. But yes, it increases our movement and walks, because if we have to, even if we think about a simple way of, I don't know if I should say this, but sometimes we think about chores. So cleaning up after them, giving them food, that is a chore, but it brings you to a point where you have to move. You know, you have that accountability to actually take care of something else.
And a specific purpose.
Yes, exactly.
You know,
That's
you
yes.
move up to a specific purpose.
Yes,
For the
exactly.
day. Yeah.
And it also improves the companionship and decreasing loneliness, like we said just now, increasing social interactions, and then also improving your wealth and general wellness. That is not something that is generally spoken of, and that's why I want to mention it now, because we think of animals, and you know, it's hard, kind of this unspoken thing of, yes, animals do bring joy, but actually bringing it down to, okay, it's actually the small things and the things that we don't take in account that actually matters. We know that animal assisted therapy hasn't been very big in South Africa, and what I want to ask you is, why do you think is that?
I think animals basically in South Africa were used for a specific purpose, like guard dog, not as a family purpose.
Yeah.
So a dog was there to take care of, but You don't involve him in family activities. And so also, it, I think it is something that came from the first world countries. It was never part of a therapy plan to involve dogs, horses, and so on. And as time goes, I think people become more invested to start with socializing their dogs, and then from there on see what they can actually mean a lot more for the individual, not only for exercise, but it calms me down. It uplifts my spirit, you know. You can go and walk as a team with your dogs. People started to change their vision
Yes, yes,
about
definitely.
about animals and how they can use them to the
Yes,
benefit for a problem.
yes,
So years back, 30 years back, people used animals to use them as guard dogs. So
yes,
they slept
yes,
outside, they were not
yes,
part of the family, and gradually people saw, but it can mean a lot to the individual family member.
yes, yeah,
And you can, there's a lot of activities.
yes,
Go and walk with your dog, but not only go and walk with your dog, go on holiday
yeah,
with your dog, you know,
yes,
pet-friendly places.
yes.
It also worked as an aid to see what benefit it could
Pretty
have to
puppy. Hello.
benefit to the family and to old age people.
Yes, and what I want to add to that is that we can definitely see that lately, even though, yes, everything is like becoming industrial and everything is becoming, if we look at the amount of householdings that can't have animals because of what
Yeah,
their, landlords have instructed them that it's not a pet-friendly place. We can see
yeah,
so many of those, but also on the other hand, so many more public places have become pet-friendly or animal-friendly. Where now these days you can go to the mall with your dog, where usually you couldn't go into the grocery shop with your dog. Um,
yeah.
so we're now, I would say, the infrastructure, the
Also
public
changed.
infrastructure is changing,
Yeah.
which is, on the other hand, it's a good thing, but having to see people not being able to have dogs because of things of like, but this is the only place that I can afford. So they are limited due to financial situations, due to certain aspects that um, limit them not to have a certain lifestyle. So like you said, like we used to use dogs for certain reasons, like dogs and horses used to also be for land work. Seeing that we don't have to just live to work. Growing up, we did have animals, but it wasn't that it's it wasn't a thing that the dogs lived inside. The dogs lived outside.
Yeah.
You also mentioned that you also grew up like that. The
Or
dogs
you,
lived outside.
it was seen as a subject. It was
Yes.
not seen as a family member,
Yes.
as a
Yes.
child. Many years back, you wouldn't actually hear of a funeral for your pet, and the opportunity is there to have a funeral for your pet.
Yes. Exactly.
Pets were seen differently as an object and not as a friend or family member. And I think through courses like socialization courses, that I think that started as time goes through media. People started to know, oh, you get this kind of course. So dogs can go to parks and go and play together, or daycare facilities. Still, people don't know about this, and take them on holiday. You never got any pet-friendly facilities, and that all started. Malls now you can take dogs with, and gradually people started to see the benefits.
Yes. So, like you say, pets were always pets. They weren't seen
Hmm.
as part of the family. this concept of animal assisted therapy. Maybe 50 years back, maybe it was, one person started seeing the effect animals have on people and started using rather just having a pet and actually using the pet to a therapeutical benefit. I also think that when it comes down to animal assisted therapy, which is something that we've been talking about, but also that I'll be talking about for the rest of my life because I truly believe in it. But it's something that really needs more awareness, and I think that is something that hasn't been a subject known previously, but hopefully that will start happening and